We've new information on the nature of the coronavirus. Latest figures from China tell us the death toll is over 1,800. The number of infections is over 73,000. The death rate in Hubei province, which is the centre of the outbreak, is 2.9%. In other words, close to 3 in 100 infections lead to death. Curiously, the death rate is much lower, 0.4% elsewhere in China, though we don't fully understand why. We do know that 81% of cases are mild, 40% severe, 5% critical, and that men are more likely to die than women. Children are also generally not severely affected. Unfortunately, the same is not true of the elderly. The highest fatality rate is for those aged 80 and over. For more on this new study, here's Stephen McDonnell in Beijing.
In one way, it's great that 80% of the people who have this virus, it's relatively mild. But 5% are in a pretty serious condition. Now, again, 5% doesn't sound like a lot, but 5% of a few hundred people wouldn't be too bad. If you have 5% of tens of thousands of people, I mean more than 60,000, we don't even really know how many people have been infected. That is, in raw numbers, a lot of people who are in a pretty serious condition.
We've also been told that 7 medical professionals in China have died and more than 3,000 health workers have been infected. On Tuesday, a hospital director in the city of Wuhan died. The chief of the World Health Organization tweeted his deepest condolences to the family of Dr. Liu Zhiming, his colleagues and patients. He says he touched and saved numerous lives during this outbreak. And central to the Chinese response to this deepening crisis is to issue more and more restrictions on what people can do. Nick Beak in Hong Kong explains.
Hubei province, where it all began, they've still got this lockdown. Nearly 60 million people being told you can't go out and about. The use of cars is not allowed at the moment. Many of the shops are shut. It's only the pharmacies and places where you can get basic food supplies that are still open. And it's only every third day that someone in the family is able to venture out and get more supplies. So it is a pretty bleak picture. And of course, if you look at what's happening in Beijing, the capital, people who are arriving there are being told to quarantine themselves for 2 weeks. So very, very sweeping measures being employed in lots of different places around mainland China.
But not everyone is staying put. 25,000 medical workers from across China have headed to Hubei province to help, and they're often working in new temporary hospitals. This is one facility, another 10 are planned, and the authorities are offering incentives to health workers to come to Hubei. Here's Celia Hatton on that.
The children of frontline medical workers in Hubei will be offered priority access, priority placements in schools. So young children will be given priority placements in really good kindergartens, all the way up to university placements. Children who write their university entrance exams, they're going to be getting extra points added onto their exam total. In China, that's a really big deal. There's a lot of pressure on children to get into good schools. So that might actually tip the balance for some people who are considering whether they should go and work in Hubei.
Well, the virus has now spread to at least 29 countries. You can see them marked in red here. And the biggest concentration outside of China is still in Yokohama in Japan, on the ship we've discussed a great deal, a cruise ship called the Diamond Princess. There are now over 450 cases on board out of what was over 3,500 crew and passengers. Now that number is down after hundreds of Americans were flown home, and also because South Korea is taking action as well. It's preparing to fly its citizens home on a presidential plane. We know that Canada, Australia, the UK, Israel and Hong Kong are also looking to get their people off the ship. Meanwhile, thousands remain stuck on it, and evidently that's affecting people in different ways. Yeah, this is some of the kitchen staff making a successful attempt to distract themselves and a successful attempt to go viral as well. Now, one British couple has been sharing updates throughout their time on the ship, and they've just posted this on Facebook today. There's going to be a time of quiet. We've been proved positive and are leaving for hospital soon. Blessings all. And this is Sally and David Abel. They're among 74 Britons on the Diamond Princess. Their son has been speaking to the BBC.
Got an email from my dad saying both your mum and I have tested positive. We're going to, the words are, he's going to a hospital. I FaceTimed them straight away. I haven't actually spoken to my dad or seen my dad. I've only got through to my mum, but I heard my my dad in the background, not sounding too great.
Now, Japan imposed a 14-day quarantine period on this ship. That's been labelled an unprecedented failure by one expert. Either way, that plan in theory comes to an end on Wednesday. Here's Rupert Wingfield-Hayes on what that actually means for the remaining passengers.
Quarantine will officially end, and the 2,000 or more passengers still on board who have tested negative will be allowed to start leaving the ship. They can walk out of this gate, hail a cab, get on a bus. But what happens then is much less clear. The British government says it is sending a plane to pick up the British passengers, but it hasn't yet said when or whether they may face further quarantine when they get back to Britain.
Let's bring in Laura Westbrook with the South China Morning Post, who's live with us from Hong Kong. Laura, thank you to have you on the programme. I understand you've been speaking to people on the ship. What have they told you?
Yeah, I'm in touch with a couple of passengers on the Diamond Princess cruise ship. They're under a lot of mental stress at the moment. The person I spoke to, he's a doctor, so he's a dentist by training. And one of the things that he raised with me was that while the passengers are being quarantined on the ship, the crew members were still working, moving around the ship. And until recently, he said that people had been provided food on open trolleys, and only the hot meals were being covered with aluminium foil, but there was still a tea and coffee service. So he was concerned that if the food was uncovered, that this could impact the spread of the outbreak. So he and his wife decided not to eat any open containers. They're surviving on cup noodles and bottled water. And actually, the captain of the ship announced just yesterday that they are going to be getting food from outside the ship, from an organization outside the ship. So there is a lot of uncertainty on the ship. There's a lot of concern amongst the passengers. It's obviously the biggest cluster of the coronavirus outside mainland China. But Dr. Lam, who I spoke to, he's going to be among some of the Hong Kongers who are going to be on these chartered flights, which are leaving Japan early on Thursday. But then when they come to Hong Kong, they're going to be quarantined for another 14 days over here.
So if that's how the authorities are approaching that particular cruise ship, what about the broader challenge of the coronavirus in Hong Kong? What kind of restrictions are in place at the moment?
So a lot of people are working from home. Schools are shut. The government announced a 25 billion Hong Kong dollar fund to help tackle this crisis, which is going towards retailers. It's also going towards subsidizing businesses to produce more masks, because that was one of the criticisms of the government in handling this crisis. People said that they were a bit too slow, and that the government itself admitted that it only had enough masks for 2 months for itself. And unlike Singapore and Taiwan, people in Hong Kong are having to buy their own masks. In the neighborhood that I live in, I see queues in pharmacies every day of people trying to buy masks, which used to cost a few dollars, now cost $100, and people are spending their own money to buy those masks and buy hand sanitizer as well.
Laura, we appreciate the update. Thank you very much indeed. There's Laura Westbrook from the South China Morning Post, and there's much more information on the coronavirus via the BBC News website. bbc.com/news is the address.